Well, thank you so much, Steve. You know I would be with you because I am very passionate about this subject, but when it comes to grandchildren, that trumps everything. So he's not here yet. We know it's a little boy. He's not here yet, but it will be soon.
That's great. Listen, one of the things that I feel is useful to highlight is that now and then something useful comes out of Congress. It's rare. But now and then, and the idea behind Washington Ideas Forum this year is that it's great ideas outside of D.C. to show what's D.C. is possible. But you cooked up something with Roy Blunt. You cooperated with Roy Blunt and passed this mental health bill. Why did you do it? What are the zingers that you want to share with us today about what this bill does?
Well, Steve, first of all, let me say I've been very grateful to be a part of two things in a Congress that's not getting much done. As you know, the 5-year farm bill we got done. And then on a very separate note, what we're talking about today is this expansion of funding and services for community mental health. And Senator Roy Blunt was my partner in this. We really were partners. And I have to say, we attached this to a short-term funding for something called the Doc Fix. People who follow Congress know the funding for payments for doctors under Medicare was temporarily extended. They said nothing new could be added. But because we had the support of both the majority leader, Harry Reid, and the Speaker, and the chairs and ranking members in the House and the Senate, we were able to do this. And what we have done is a first step pilot project based on our bill, Excellence in Mental Health Act, that will designate 8 states that will develop more comprehensive mental health and substance abuse services and get paid their costs for it. Now, why does that matter? Well, right now, we have something called community health centers that get paid for the services they provide. They get paid adequately. In the area of community mental health, they are woefully underfunded, have been for years. So when we talk about mental health parity, and I was pleased to author that in health reform so that insurance companies have to provide the same copays and the same premiums and the same coverage, we don't do that in the community. And so we worked very, very hard. We brought together a huge coalition of folks from the Iraq and Afghanistan veterans who have this as a major priority, 22 veterans committing suicide a day, most of them in the community, needing help in the community, sheriffs who end up having people in their jail who ought to be getting services, hospital systems, families.
So let me just jump in there for a minute, Senator. Just to de-wonk this for a second, you're beginning to walk through some of the human dimensions of this, and I guess perhaps my editorial, less friendly question is, why, despite this legislation passing, why when it comes to mental health are the steps that have been taken so small? In other words, you've passed something, but it's not a huge bill. And I know that I had a briefing recently with the National Council of Behavioral Health, was saying there are things out there like mental health first aid, where everyone where people get trained and certified, like CPR. But when you really put it on the face of it, we're talking about mental health. It's a nice, earnest thing. If you scratch between communities around there are problems everywhere. But we're kind of dealing with it in a pathetic way.
Well, you know, there's been a bias, Steve, and a misunderstanding for years. We need to treat diseases above the neck like we treat diseases below the neck. And the good news is right now, if we do that, people can manage mental illness and go on and lead productive lives. If you have diabetes, you manage your sugar and the imbalance in the sugar, and you're able to go on with your life. If you are bipolar, you have a chemical imbalance in the brain. We can do the same thing. We can give people the tools, medications and therapy to manage that and go on with their life. But it takes an understanding that we can do that, and it takes changing the system to treat all kinds of diseases the same. You're right. We are woefully behind on that. And I have personal stories. My father, when I was growing up, was bipolar and nobody knew it, and was in and out of the hospital, didn't get any help for years and years and years. Finally, when I was in college, There, we discovered this new drug called lithium. That we called it manic depression. He got medication and went on to manage his disease and be healthy the rest of his life. We can do that today, and we just need to understand it and be serious about it.
You know, Senator, I've been interested today that Tim Cook, the CEO of Apple, acknowledged publicly that he was gay. And this reminds me of Harvey Milk reminding everyone who's gay to come out, reach out to their parents, their friends, their neighbors. Do we need to see something like that with mental health, people with challenges who are in environments where they feel more comfortable talking about my father, my brother, my sister, myself, to come out in a way to get sort of a larger footprint of action, if you will?
Yes, that is a really good point. It makes a difference when I talk about my dad, when others talk about family members. I want to give a shout out to Glenn Close, who's not only a great actress, but joined me 2 different times in Washington at events and in meetings. She brought her sister, her wonderful sister, Jessie, her nephew, both who suffer and manage mental illnesses, and their powerful stories made a huge difference for us. 1 out of 4 adults every year, right now, this year, will have some kind of mental illness. We need to stop the stigma and understand it. It's a disease or a series of diseases like anything else. There is hope. There is help available. We just got to make sure that people reach out and get the help and the support they need.
I mentioned mental health first aid for a moment. Is that going to be part of your legislative agenda in the next Congress?
Absolutely. There's a series of things that Senator Tom Harkin, as chair of the Health Committee, put together. And that particular bill you're talking about has been led by Senator Mark Begich, and Senator Al Franken has been very involved. There's a whole group of folks. Education for teachers, for law enforcement officials, research that needs to be done. You know, the whole effort, and I congratulate the President and NIH now for having the BRAIN project. We're actually focusing on research on the brain, the least researched organ in our body that probably has certainly as much, if not more, impact than any other organ. And we're really finally doing the kinds of research we need to do, not just on mental illness, Parkinson's, Alzheimer's, MS, whole range of things that we can find cures for if we are willing to really do the research necessary on the brain.
You know, the other day I was in Boston and I asked Senator Ed Markey in a conversation what he would do if he weren't running for senator but were running for president. And I just wondered how he would act. He didn't act nervous at all, didn't miss a beat, which makes one wonder what his future intentions might be. But he said without missing a heartbeat, I would have a conversation on a bipartisan basis with the nation and I would triple the NIH budget. Because of a broad set of issues like this. And I'm wondering whether that sort of focus, not just on the community dimensions, but also on basic research, is something that you feel needs a lot more attention and financial support. And what would you be willing to give up yourself in terms of funding NIH? What would you give up?
Well, I missed the last piece of it. What would I be willing to give up? Well, I think it's a matter of making sure that we we can have a tax system that's fair. I'd pass a bill of mine that stops paying for write-offs for companies that ship jobs overseas, and I would put that into the National Institute of Health. The reality is that from a dollar standpoint in savings, lives, quality of life, and money, the best investment we could be making is in the National Institute of Health, not only around mental health, addiction, but 1 out of 5 Medicare dollars go to someone with Alzheimer's. And we have the opportunity now. We're so close in so many areas. That's why things like the government shutdown were of concern to me and so many others, because it impacts, those cutbacks impact things that we don't see every day, but have tremendous impacts on our lives and our quality of life going forward. And NIH is at the top of the list.
Well, thank you so much for spending time with us this morning and sharing us with these thoughts on mental health. Ladies and gentlemen, Senator Debbie Stabenow, thank you.
Thanks so much.